right, everyone. Dr. Ryan is on the line. Good morning, Dr. Ryan.
Good morning, Mark. How are you?
I'm doing well. Thank you very much. And before we get started, I just want to say that I was at the grand opening of the new medical facility here in Idaho Springs. I got the tour, guided tour from a VIP. I saw all the facilities, including Dr. Ryan's office, and was happy to see him face-to-face, masked and distanced, of course. But it's quite a facility, and all of you out there who haven't had an opportunity, I'm sure if you went by and just asked to take a quick tour, somebody might help you do that. Is that possible, Dr. Ryan?
Oh, absolutely. We are a community center, so this is a center, medical and healthcare facility that was built for the community. So absolutely, all are welcome.
Okay, so I encourage everyone to do that very thing. It's a very warm and welcoming facility, and the staff is equally as welcoming. All right, Dr. Ryan, I wanted to zero in on what looks like a shift in the caseloads across the country. We've known that there's a dynamic to the Delta variant where it seeks out pockets of those who are unvaccinated, and now it seems to be focused on the western and northern regions of the country. Any comments about that?
So, yeah, to your point, as you know, over the last several months, cases in this country have been extremely high, and we're now seeing a decrease over the last several weeks across the country. However, there are still pockets across the country, including Colorado, where our case counts are actually not declining. Where here in Colorado, we were on a plateau for about 3 weeks, and now over the last 2 weeks, we've seen a steady increase in cases. And hospitalizations, and so the story goes. So it's a hopeful sign across the country, but here in Colorado we have a different story going on, one that we're actively addressing.
I noticed that the states surrounding Colorado have increased cases as well. When you look at the top states for COVID per 100,000 residents, Wyoming is on that list, New Mexico's on that list, Utah's not far away, Idaho, Montana, and I wonder if some of their more severe cases are finding their way to our state.
Absolutely they are. So every day the state of Colorado receives calls from surrounding states and other states that don't even touch ours requesting patient transfers. So patients from Wyoming, as an example, that doesn't have significant ICU capacity at all. The vast majority of those patients will need to come here to Colorado. Similarly in Idaho and other states. So cases there have been up significantly over the last several months. So they have been really struggling for the last several months and are hoping that in the near term they will have a reprieve or break. But the vaccination rates in those states is quite low. So there is quite a population yet to get infected. And so that's really what's driving those numbers up there.
Yeah, I'm sure the vaccination rate is the primary driver, but it seems to me there's another social dynamic attached to that. The folks that aren't vaccinated seem to be those most likely to not wear a mask or social distance as well. There's just a general disregard for the implications of COVID infection among that population. I don't know, maybe I'm reading that wrong. What's your take?
No, I would agree, and I don't think this scenario has changed. The general feeling and the lack of any public health measures, to your point, social distancing and mask wearing, in states like Wyoming and Montana. Having lived and worked there for the last many years, it would indicate that, yes, that is a huge driver, where they don't think COVID is real. They don't think COVID is the problem. So masking and social distancing aren't a part of their normal protocol. But what that does is it lends itself to spread. When COVID walks into a town, metaphorically speaking, it can absolutely decimate the town because there are no other public health measures in place. And so when one person gets it, it spreads like wildfire.
Okay. Well, the thing that's at the top of most people's minds right now, at least those that have been vaccinated, is, of course, the boosters. And my wife, who had the Pfizer vaccine, received her booster. She's just happy as she can be. And I'm looking forward to my Moderna booster. I heard you say with the county commissioners, you reported that you expected some word of some kind on Thursday from the FDA and CDC, presuming that there is emergency authorization granted for Moderna and for J&J. I heard you say you had some clinics planned. Can you? I know I'm getting out on a limb here, but can you at least give us a broad general sense of what that might look like?
Sure. So, yeah, as you said, on Thursday, we'll have likely the answer to all of our questions about what the next several weeks look like. What we're planning is to vaccinate and booster as many people as we possibly can over the coming weeks, particularly the first several hundred that we had here in our county who received that vaccine first in both first responder population, but also in our elderly population. So I don't have dates set up yet. I don't want to put those out there until we have full confirmation that we can do that. And then making sure that we have the supply, making sure we have enough vaccine, making sure, because these are partial doses, likely. They're not going to be the full dose that everyone received initially. We're going to make sure that we have syringes that are small enough so that they can draw that smaller dose out of the vial. So we're doing our part on this end, making sure that we're ready and able to vaccinate all those who need it, and waiting for word from the CDC and FDA. If, in fact, they do approve it on Thursday or Friday, we will likely have clinics next week in the following week to accommodate those folks. We're going to use the facility that you just mentioned at the start of this conversation and funnel people through here. This is what the clinic was built for, and so we think we can accommodate however many people it is that we have come on any one of our clinics.
Okay, so it's unfortunate timing in the sense that your report to the county commissioners is on Tuesday. Our conversations are on Tuesdays. And so how can people find out once there is word one way or the other from the federal authorities, and you have made definitive plans, how can people find that information?
A great question. So a number of ways. The first of which is we will post it on our Facebook page for the county. The second is we will post it on our website, the place that you find all your COVID information. And we will also post it on our information, COVID Vax information line. And I can give you that number now so that folks can call that. I would wait until maybe Friday until we actually have information and we have decisions that have been made. But that vaccine line is 303-670-7528. That's 303-670-7528. And we will have information on there if, in fact, it is approved, and what our vaccine clinic schedule will look like for those individuals who are eligible. And those are the three primary ways that we have to communicate. And we'll get that information up as quick as we possibly can.
Very good. And just to remind folks that website is clearcreekcounty.us, Clear Creek County, all one word, .us. And you'll see that COVID button right there at the top of the page. Okay, so that's good news, I think, on the boosters. I have a lot of anticipation, and I think I've got positive thoughts. We're going to have that. In the meantime, I wanted to bring up Mr. Powell, Colin Powell, who passed away this week, because I see this. There's been talk about among vaccine deniers and anti-vaxxers that see what's the point of getting a vaccine if someone who has access to the highest level of care in the country can't be protected. And I wonder if you could speak a little bit about his unique circumstances and how it relates to the general public's position.
Great point. And I actually had the honor of meeting Colin Powell shortly after he retired years ago up at CSU. So it was a great honor. So Colin Powell, and now that he is deceased, his medical records are public. Colin Powell not only had COVID, but he was suffering from Parkinson's disease as well as fighting cancer. So it is highly likely that those combination of those two things, cancer and Parkinson's, suppressed his immune system significantly. So no matter the vaccines he got, it wasn't going to save him, to Commissioner Wood's point. There was no saving Colin Powell, unfortunately, from what happened. That happened. He was a part of what we consider the most vulnerable population. His immune system would never be at 100%. It was actively fighting three different things ongoing. So the vaccines are intended, and COVID isn't unique in this sense, vaccines are intended to prevent you from getting severe illness from the virus. And they're very effective at doing that. They're very effective at keeping the vast majority of people out of the hospital and dying. That's their intent, and they're very good at doing that. To my point earlier, almost 80% of the people currently in the hospital are among the unvaccinated. So I think from an odds perspective, are there going to be people who are vaccinated who are going to end up in the hospital or die? Absolutely. They are few and far between, and they are individuals who generally have underlying health conditions that the vaccine itself is doing something, but it isn't necessarily going to prevent them from ending up in the hospital or dying. It's very good at protecting the rest of us. It's very good at protecting the healthy individuals and keeping you out of the hospital.
Well, I'm glad you brought up the question of the hospital because, first of all, quickly, I wanted to say that I heard you say 80% of the folks who are hospitalized with COVID are the unvaccinated. And I actually saw in national news that 90% is the average nationally. But here in Colorado, that's maybe we're a little bit of an anomaly, but that's within the ballpark. My main question has to do with hospitalization, because all during COVID we have heard numbers about the hospitalized and the stress that's been put on the hospital systems. And I wanted to bring this up because whether or not 100% or 1% of the folks that are in the hospital or in ICU are COVID related is almost immaterial, because we live in a world and an economic system, including our medical system, that it is analogous to the just-in-time inventory system. In other words, there isn't a redundancy of hospital beds just waiting around for a pandemic. There's just enough hospital beds and just enough ICU beds to accommodate that normal fluctuation of hospital patients, and there is no extra capacity to accommodate a surge that's associated with a pandemic.
Absolutely. And the unfortunate reality now is different than before. Before, there were staff that weren't working 18 months straight tirelessly. They had breaks. They had the ability to take vacations. They had the ability to sort of take time and process things. Poudre Valley Hospital is a great example. For 2 straight months now, their ICU unit and their staff have been working tirelessly for 2 straight months at or above capacity. So there are no beds available. So if you're in Larimer County right now and you have a heart attack or a stroke, you're not going to go to Poudre Valley Hospital. They have no room for you. You're going to have to go to somewhere else. You're going to have to go to a different hospital and hope that they have room for you there. So we may have started with 1,800 and some beds in this state that were ICU capable. That number is no longer relevant because there aren't staff to staff 1,800 beds, ICU beds. It requires a team of staff members to take care of someone who has a tracheotomy tube down their throat. It takes a lot of people to manage that individual who is, for all intents and purposes, unconscious. And so our capacity has significantly decreased. Nurses and doctors and staff are exhausted. I'm friends with a number of them, and they tell me every single week the same story. They're absolutely exhausted. So they're quitting. A number of them are quitting. And what it's done is it's reduced our capacity across the state. So for an unvaccinated person to say, well, the hospital will be able to take care of me, that is absolutely not taking into consideration those people on the other end who've been working their butts off for 18 straight months and haven't had a break. And are supposed to magically be there because you're not willing to take a vaccine and prevent that disease from happening and keeping you out of the hospital. You're just going to rely on them. Well, unfortunately, more of them are quitting. And so more of them aren't going to be there and available when you decide and when you get COVID and you end up in the hospital. So that's the reality.
Yes, I'm afraid that I know that that's true, and this relates back to a subject we talked to a couple of weeks ago, and that is the difference between prevention and treatment, and somehow we've become convinced in this country, if I'm sick, I'll just be treated, and everything will be fine, regardless of the fact that prevention is 100% and treatment is some lesser percentage than that, and much more expensive. I don't know why people think that way, but many seem to.
Right, and another difference between those two, aside from cost, which is a huge one, is prevention is an action that you as an individual take. Right, I put my seatbelt on to prevent me going through the window. Treatment relies on others, and it relies on a system, and it's a dependency on that system to provide you with the treatment because you didn't prevent this from happening. And so those are two very different scenarios. One is an individual choice and an individual's behavior on taking a vaccine or putting your seatbelt on, and the other is highly dependent on others. And so I think in a country like America, where we supposedly pride ourselves on independence and doing things ourselves, but yet here we are in spades. Half of the country has suggested that they are not, in fact, in that camp. They're in the, I would rather rely on the system once I get COVID to take care of me and treat me at a far higher cost, to your point.
Well, that's a great take on that, Doc. And I know a physician friend of mine who has quit the business entirely. I can't stand it anymore is the explanation, and I just know that the people who are still working in the system are completely frustrated, and I don't know where we're going to go from here, but we need to thoroughly examine not just our response to COVID, but what we've done right, what we've done wrong, where we can upgrade the system and make it more responsive at a lesser cost. I know there are ways that we can do that. We got a lot of smart people in this country who have some great ideas. It's a question of the political will to listen to them.
Exactly.
All right. I wanted to talk about one last thing before we go, and that is I've read a number of articles in the national press recently about the various states and the laws that they're passing that are restricting the flexibility that folks in your position as the head of the health department, the flexibility that you have in responding to medical emergencies, and I wonder if you have any thoughts about what's happening. I know there's been hundreds of such laws passed around the country, and there are many more that are pending in legislation. Do you have thoughts along those lines?
You know, anything that we can do as a society, whether it be from a legislative perspective or political perspective, otherwise, to better serve our community is in my mind good. A robust public health system is absolutely critical. I think this pandemic has shown that in spades. Not only from a health perspective, but from an economic perspective and every perspective you can imagine. So rather than see people seeing it as an infringement on my right of this or that, it's more a betterment of our society. And if we need legislative actions to do that and put things into statute to make sure that we have the tools to better address, in this case, a pandemic, I think that's absolutely important.
All right. Well, Dr. Ryan, I look forward to the boosters and maybe even a mix and match. I'm not sure what that means for those of us who have had Moderna, but I guess we'll find out when the leadership at the federal level gives their authorization, hopefully later this week. Is there anything else that you wanted to cover or remind folks of before we go?
I would just say, please, if you are unvaccinated, please consider getting vaccinated. It is your right to have free preventive measures available to you that are both safe and effective, that have been given to hundreds of millions of Americans and billions of people around the world, where the clinical trials have met or exceeded the rigor of any other clinical trial in human history. It is a safe and effective way to prevent you from getting COVID. Just because you're 20-something or 30-something or 50-something and healthy or perceived healthy, without the vaccine, COVID can put you in the hospital and can kill you. It is significantly less likely when you get the vaccine. I like the odds of having a far fewer chance of going to the hospital or dying by taking a simple vaccine. So I would strongly encourage that. We're having clinic every Wednesday. We're going to have additional clinics in the coming weeks, as we have discussed. If you have additional questions or concerns, when you come, the nurse will be happy to entertain those questions and concerns and give you the information you need. I would also recommend going and finding sources of information that are fact-based. YouTube, Facebook, your social media is not a place for information. It is not a place to get fact-based information. It's full of opinion. And those opinions, from my experience, are more often wrong than not. The number of people who say to me, oh, my friend told me this, or so-and-so told me that, and what qualifications does your friend have? When you need legal advice, you go to a lawyer. You don't go to your friend or neighbor or some dude on Facebook. You go to a lawyer because you value their expertise and you value the knowledge base they have. This is no different. Trusting the people who know best, the medical apparatus in this country and the public health apparatus in this country are the experts, and they know best. So listening to what messages are put out there and following those is critically important. If we want to get out of this pandemic, that's the only way. Here we are 18 months later. We thought this summer with the vaccines things would be changing, and here we are in Colorado with our case counts going up. There's a reason and rationale for that. It's because the number of unvaccinated folks that we have in this state and in this country are driving it. It isn't the vaccinated who are driving this now. We're unfortunately being held hostage and sitting and waiting for the rest of the country to see the light.
Well said, Dr. Ryan. And I just, one last thing that I meant to bring up, and I just want to throw this out there as we say goodbye. The flu vaccines are out there as well. I had my flu vaccination, and those of you that are anticipating a booster, it's a great time to get your flu vaccine as well.
And that's free of charge. We do now have the 65-plus flu vaccine available for those folks who are 65-plus. And that is, of course, free of charge as well, and happy to do that at the same time as the COVID vaccine.
Thank you so much, Dr. Ryan. We'll speak with you soon, I hope.
Sounds good. Be well.
Goodbye now.